Welcome back to TV5. It's time now for Aging in Style with McLaren. We're here with Dr. Christian Hyde this morning. Thank you so much for joining us.
My pleasure. Thank you.
So we're talking about Colorectal Cancer Awareness Month. Tell us a little bit more about that.
So we're trying to get more attention focused on colorectal cancer. It's a cancer of the large intestine, and it's very serious because it kills more women than breast cancer, and it kills more men than prostate cancer.
And how do you know when it's time to see a doctor?
So most people have no symptoms. This is one of those diseases that we call a silent killer.
Okay.
Because by the time you're having symptoms, sometimes the cancer is already spread. So it's really important to get screened. The two main screening tests are colonoscopy, which is where a doctor uses a scope on a flexible tube to go in the colon and look around. That's the traditional way to find these sorts of cancers. There's a newer test that's non-invasive where the company sends you a kit, you put a stool sample in the kit, you close it off, mail it back to them. It's totally non-invasive.
That sounds like a much easier option for a lot of people.
It is. Unfortunately, about 44 million people who are at risk are not getting screened because with the traditional screening, you have to drink a lot of flush to empty out your colon.
Okay.
That takes a day off work. The next day, you go in and have the test performed with the colonoscopy, and that also eats up another day.
What age should you maybe start paying more attention to this?
So it used to be that age 50 and above, they would say get a colonoscopy every 10 years. So that means age 50, age 60, age 70, go in, get a colonoscopy. But we found that a lot of people were dying with this disease between the age of 45 and 49. So the American Cancer Society now recommends that screening can begin at age 45.
Okay, so it's really about early detection and, using those preventative measures ahead of time, so.
Correct. Fortunately, we've seen the death rate come down a lot from breast cancer and from prostate cancer, and that's because of screening. We have mammograms. There's a lot of attention about going and getting your mammogram, and for men, about having a PSA test. We have an early screening test for colon cancer, but only about half of the people are getting it, and so hence the need for more public awareness.
Yeah, and what treatment options are available for those people out there who may find out that they have this?
Sure. So caught early, this is a very curable cancer. About 90% of patients can be cured when it's detected at stage 1 or stage 2, and that's best done through these screening tests, either the DNA kit that looks for cancer in the stool or the colonoscopy. Once you've been diagnosed, there's usually surgery involved to take out the affected part of the colon. The cancerous part is removed, the colon is reconnected. Some patients who have more advanced forms of cancer may also benefit from radiation, which is focused energy that kills cancer in that area, or chemotherapy, which is a drug usually given by vein that circulates through the body and kills cancer cells.
I think when people hear the word radiation therapy, they get a little bit scared.
Sure.
So I guess, how does this radiation therapy kill the cancer cells? I mean, people need to know that it's maybe going to work, or hopefully going to work for them.
Correct. So we've been using radiation therapy for about 100 years now to treat cancers, and it is effective. Cancer can be cured, and radiation is often part of it. For this disease, cancer can spread to lymph nodes, and radiation is very effective when given to help sterilize or kill the cancer out of those lymph nodes. The way that it works is that X-rays are focused through the part of the body that's at risk for cancer, and it helps kill off those cancer cells, making it possible for a cleaner surgery to be performed where all of the cancer is removed and less chance of cancer being left behind.
Is there anything else that you would want to tell people just about prevention and about doing those early screenings, why it's so important?
Sure. So you ask about prevention. There are things that make a difference in our lifestyle. Number one cause of preventable cancer in this country is tobacco. People think about smoking as being a risk factor for lung cancer. It's also a risk factor for rectal cancer, because those carcinogens that are inhaled, there's about 67 carcinogens in cigarette smoke. Those carcinogens are absorbed into the blood, and those cancer-causing chemicals circulate throughout the body and can cause these abnormal cells to grow into cancer.
Okay.
So it's important to quit smoking. Alcohol is another risk factor, and maintaining a healthy weight being physically active and eating healthy. By that I mean vegetables, fruits, the things that Grandma and Mom always told us to do.
Yeah, we hear that a lot, and it can help with a lot of things, not
True.
just this.
Yeah, it's good for the heart, it's good for the brain.
Thank you so much for being here with us. We really appreciate it. And if you want any more information about today's topic, you can head over to the Aging in Style page on WNEM.com.